Did you know that cancer is the #2 leading cause of death in the world? Yeah. And it's also some countries or some areas in some countries that is becoming #1 cause of death. And this is something that some people say, well, this is something that has been around everywhere, and it's now that we have more tools to make a better diagnosis. And part of that, it could be true. No, the greater incidence that we're seeing today, it's something that it's getting out of our hands. It's something that it's really, really growing. But today I want to talk to you about gastric cancer or cancer in the stomach. And some people sometimes forget and say, well, I don't really know what the stomach is. Because the stomach, some people sometimes say, I have stomach pain. And they are pointing the abdomen. But it's very different, the stomach from the abdomen. So let's remember just for a second, what is the stomach? Which are the functions? And now we're going to see which are the symptoms in which you can go and talk to your physician, go talk to your doctor, and so you can know what to do and do it fast. So, sorry for my drawings. Here we have our head. Here we have the conduct that brings food from our mouth into our stomach. Is called the esophagus. And you might be saying, okay, but what's the stomach? This from here to here is the stomach. So the stomach has 3 parts. It has the fundus, which is this part in here. It has the body, which is this part in here. And it has the antrum, which is the part in here. Here, it has a valve that it's a closing valve, that it's the valve for the going out to the intestine. What does it do? It has a valve in here that is called the pylorus, and it's called the inferior esophageal sphincter. So we have 2 muscles that are helping for the closure, one in here and one in here. Why? After you swallow, the first part of digestion inside the abdomen is the stomach. You need the stomach to get the acid and get enzymes, like the enzymes that are going to break protein, to start doing like a second chewing. It starts contracting and contracting and contracting and contracting, mixing everything that you just ate, and it's preparing so it can go out to the small intestine, so you can start digesting and absorbing everything that you need. But those parts that I just mentioned in the stomach are going to be very important regarding with the symptoms that you might feel with gastric cancer. Most of the people think that if you have a gastric cancer, it's because you have a lot of pain. And of course, this is the symptoms that you're getting, and it's something very easy to diagnose. Did you know that up to 70% of the people that have gastritis, that have esophagitis, or some sort of GERD, but without symptoms, some sort of reflux without symptoms? And you might say, oh, no, that's impossible. No, it's completely possible. Most of the people, they have no clue. And it happens all the time. Patients come to my office and they say, it's funny. I just got an endoscopy done, and look, it looks like I have a gastritis and I don't feel anything at all. And I go and start working with them because you might feel other symptoms related to a wrong gastric function that are completely related with the stomach, but maybe it's not the symptoms that you're thinking. Symptoms such as burping after meals, being bloated all the time, getting gas, or farting all the time during the day. And you might think, oh, but that's something with the colon. No, that's something manifesting in the colon, but maybe a wrong digestion that started wrong in the stomach could be the cause. But not all the time people that get gastritis or that get reflux are going to get symptoms. What has to do gastritis or reflux with all of this? Gastric cancer occurs when chronic inflammation starts making cells to start converting into a tumor, converting into a cancerous cell, and then it's going to start growing. And also, I've seen patients that they have gone to take an endoscopy as a procedure just to take care of themselves, or as something, maybe a requirement before they get a job. And they have this sad news that they have a tumor in their stomach without noticing anything at all. So which is the first symptom that I need you to be aware of? If you have chronic gastrointestinal issues or GI issues, please, this is not normal. It's become habitual. But the fact that this has become habitual, it doesn't mean that it's normal at all. The first symptoms that you need to be aware is any GI symptom, go to your physician and ask for an endoscopy, because this is not normal. Something might be going on without being noticed. Number two, you could have a problem with swallowing. It could be painful, it could be difficult to swallow. Cancers that occur here where the esophagus meets the stomach, there occurs a lot of cancers that are due to chronic reflux. Why? Because when we have reflux, when this is not working well, when we have reflux, the cells in the esophagus that are completely different from the cells inside the stomach, they're two different tissues, very different. Although they're very close to one another, things should be going this way and not going backwards. So when we have chronic reflux, these cells start to look very alike to these cells. They change. That's called metaplasia. They change. And that's called Barrett's esophagus. Barrett's esophagus can start growing because of a tumor, and it can convert into a cancer. And that, of course, can give you symptoms of any difficulty or pain when swallowing. The other thing is, if you have chronic nausea, or you're vomiting, or with those, if you're losing weight without any other cause. If you're on a diet or exercising or in any other treatment for losing weight, but you are still losing weight, it could be one of the causes. And again, if you're feeling nauseated all the time and you have gone any other reason, if you're a woman and if you're not pregnant, well, go and look and see, because it's not normal. If you're vomiting and you have no clue when you're vomiting, then you need to go, and it's going on and on and on and on. You need to go and check your physician. The other reason is any blood. And with blood, I need to tell you about two conditions. The first one, if you see, of course, if you're vomiting and if you see any blood, it could be because the cancer, it's a little bit ulcerated, and that ulcer is going to make some bleeding in the stomach, and that, of course, is going to make you vomit. But not everyone that has gastric cancer, the only way to have blood, it's going to be through vomit. Something that you could also see is when you have a change in your stools, they're going to look black. It's going to look that the blood is already digested. If you see blood in your stools that is red and fresh, it means that that bleeding comes from a lower part of your digestion, because it's almost when it's going out. That's why you see it fresh, red. But if you see that your stools, all the stools, are completely black, it means that all that blood that the cancer inside of the stomach is producing is moving forward. It's being digested. It's mixing with everything else, and it's going to give that black color in your stools. The other symptom is going to be if you eat and you feel full very fast. Why? Because if you eat and you feel full very fast, it means that there is a tumor inside in here giving you the effect of something just occupying the inside of the stomach, as if you just ate, I don't know, a couple potatoes before. That means also that maybe that tumor is quite big, and it's occupying part of the gastric content, and it's something that it could be very related with cancer. And number 6 is very related with something that I told you at the beginning, and it's not everyone that has a gastric cancer is going to have GI symptoms straightforward. So most of the symptoms that people get are not because of the gastric cancer. It's because of the metastasis of the cancer. So if they get symptoms in their colon, or if they get a metastasis in the liver, in the lungs, in the brain, and it's one of the cancers that when treated properly, it's completely curable, and is one of those wins that we as physicians have gotten with cancers all along the different variety of cancers that we could get in the body. So again, guys, this is something that we need to take very seriously, and please, please, please don't normalize symptoms, and go ask your physician for an early diagnosis, and be always checking to have a good digestion. Always, always, always. And please remember that the best way that we can continue growing this community is by sharing the videos. And also remember, please, to hit the like button. Please remember to subscribe to the channel. And please hit the bell, so every time that we make new videos, you're going to be the first one to be notified. Thank you guys, until next time.